When my career unraveled, I went on a wild ride, from employer-provided health care to COBRA to self-insurance. My wife and I struggled to get that big monthly bill down, and it seemed like it was working. That is, until I busted a tooth right after we dropped dental coverage.
But while I got by, Katie Prout had a different challenge. She was looking for mental health care, and her search reveals the disparity that often leaves the most vulnerable people on their own.
Medicaid was very good to my body, but pretty bad for my brain.
In the fall of 2019, Katie Prout was determined to find work as a writer in Chicago. But as I know too well, finding a job in media these days is not easy. Newsrooms across the country have drastically downsized over the years.
I had some interviews and a lot of them were falling through. I just couldn't get a job and couldn't get a job and couldn't get a job. And it felt like this nightmare that I couldn't wake up from.
With no real prospects and her health insurance running out, Katie applied for Medicaid.
I was getting increasingly depressed, and then the pandemic hit and everything just went sideways. Facing the sort of stretch of unemployment that I had already been on and these unfocused days, my mind really started to become a darker place.
Katie had long struggled with mental illness and now faced a serious hurdle: finding mental health care on Medicaid.
Looking for a therapist who took Medicaid was just really not an option. I managed to find a private clinic that offered an intern. I just had to pay $25 out of pocket.
But lockdown after lockdown made Katie's psychological distress worse, and she's not alone.
Suicidal ideation is something that I have bouts of. I remember one time waiting for the red line, late 2019 or early 2020. I had a strong image or urge or temptation of just jumping in front of the train before it came. And it scared me.
She'd been taking medication, but it just didn't seem to be working anymore. Katie tried to find a psychiatrist who takes Medicaid to reevaluate her.
I can't even select that as a category for psychiatrists because they don't accept Medicaid just by and large.
Katie's experience brings up a troubling division inside America's healthcare system. Health insurance, public and private, has always drawn a distinction between bodily health and mental health. If Katie had a chronic physical condition, it would have been a lot easier to get help.
And even though Medicaid has expanded across the country, many mental health practitioners don't accept it, citing low reimbursement. On top of that, they can't keep up with a surge in demand after COVID, leaving less well-insured or low-income patients scrambling in a game of medical musical chairs with dwindling access.
Trying to navigate the mental health care system through Medicaid was absurdly complex and a lot of dead ends. And so I would go through a period, much like applying for jobs, where I would do a lot of it, and much like with jobs, wouldn't hear back. So then I'd be I'd give up.
But Katie found an outlet and a sense of purpose by helping people suffering from substance abuse.
I would go down to the South Loop and hand out harm reduction supplies. And as I got to know people better and they would talk to me about their lives, people would also open up about their own emotional turbulence.
Through those conversations, Katie unexpectedly got some advice for where to find a psychiatrist that accepts Medicaid.
I felt lucky to be able to find the psychiatrist when I did, but it was a bitter kind of luck because you shouldn't have to need luck in order to get your needs met.
In November 2021, Katie finally got a full-time job at an alternative weekly and now has health insurance through her employer.
But she makes just $45,000 a year, not adjusted for inflation. It's what I was making for similar work 35 years ago. More people enter a shrinking profession every year, and that bids down the price of labor and makes it harder for workers to fight for better wages and benefits, like quality health care.
It is certainly not enough money for an adult really to do anything with beyond live, like in the immediate present. These are the medications I take daily, and the last time I picked them up, I had to pay $60. When I was on Medicaid, I didn't have to pay for any of it, which ruled. So I'm getting used to having that like out-of-pocket expense.
Katie and her fiancé Carter want to start a family, but Katie worries that's not an option given her current salary and benefits.
We can't afford to pay childcare. Does that mean one of us, probably me, would drop out of the workforce?
She and her colleagues at the newspaper have been negotiating for better wages to pay for their health insurance.
What we need no matter what is simply more money. And I see that as part of like mental health care too.
What I saw in my own pandemic experience wasn't a mental health challenge, but it was a personal health crisis. As a gig worker over 60, I learned that sick days are just salary-free days off. Even if work dries up, that $2,800 a month health insurance bill still comes due on the 1st, and the electric company isn't going to take a podcast, a column, or a TV documentary as payment in kind. But after hearing from Lisa, Ishani, and Katie, and adding my own experiences, it's a reminder that the question now for we Americans is not, why me? But given the realities of work and getting health benefits in this country, the better question might be, why not me? I'm Ray Suarez.